Our next presenter received her PhD in physiology, followed by a 2-year research fellowship. She's a board-certified dermatologist, and for the first 10 years, she practiced conventional dermatology and taught in the hospital residency program. After some personal health issues and with her research background, she began to realize that skin health was more than skin deep. Since that time, she's been practicing an integrative approach to skin conditions and skin health, and has been treating and educating patients about lifestyle changes, environmental toxins, and topicals that contribute to or detract from skin health. As a practitioner, she tries to combine the best of conventional and alternative therapies to treat a variety of skin conditions. Please help me give a warm welcome to Dr. Jennifer Childers.
Okay, well, I'm really glad to be here, and I'm also a little intimidated because so much has been covered, but a lot of what I have to say has already been covered, so that's actually a good thing. My talk, the title is Making the Most of the Skin You're In, and the skin, as you all may or may not know, is your largest organ. So your skin actually reflects a whole lot of things that are going on inside your body. And good skin, like good health, is a balancing act. And we've already heard a lot about toxins. We've heard a lot about nutrients. And I'm not going to talk too much about it. But one thing I would like to say that I think has not been covered is people talk about sunshine in excess. And I'm just going to say that it is true that we do get our vitamin D from the sun. It's also true that what's going on now is that many people, even those who've had quite a lot of sun exposure, are deficient in vitamin D. So my suggestion is to protect your skin from the sun and then prevent all of those liver spots, which people used to call liver spots, that are truly sunspots and are actually evidence of inflammation in your skin. You've all heard about inflammation. They're actually evidence of oxidation of your skin, all of those brown spots. And to protect your skin from the sun with a sunscreen that does not contain chemicals, that has basically zinc and/or titanium in it, and to take your vitamin D and get your levels checked, because that's really the best way right now, I think, to get vitamin D. So I'm going to move on. Trans fats, you've heard about all of these other things that I don't actually have to cover, which is really awesome. The nutrients, you've heard a lot about the nutrients too, and I'll talk a little bit more about those in a little bit. Normal and abnormal skin. So normal skin has very tight junctions. You can see that the normal skin has tight junctions, and you can see the layer of stratum corneum on top. And what happens as we get older, our skin, the cells start to shrivel up, and some of that is from aging, and a lot of it's from toxins, especially like trans fats. You know, these are what happens to the cells that when the cells are actually, the trans fats are actually used to form the cell membranes. They get all shrunken. You get all of these holes between the cell membranes. The water leaks out. You become dehydrated, and your skin actually becomes extremely fragile and not as wrinkled and not as attractive. So this is what your skin looks like, and the very large portion of your skin is actually fats. And you've heard a lot about good fats, and in truth, in order to keep the good fats and to keep this nice lipid bilayer on your skin, you really need to have good fats, both in your diet and on your skin topically. And coconut oil is actually one of my very favorite oils to put on the skin because it's completely natural. You buy the organic coconut oil, it sinks in, and it's actually incorporated into your skin as your skin grows. And, you know, new skin, one of the slides I think said that 2 weeks it turns over, more like 21 days. Some of the skin cells may take a little bit longer, but 2 to 3 weeks, you get new skin. So if you start using coconut oil, in about 3 weeks, you'll have pretty much new skin, and it's pretty awesome. You've heard a lot about the theories of aging, and I'm only going to talk about 2. The telomeres are the ends of the DNA molecules that maintain the integrity of our chromosomes. And, you know, so it's this. There's been some work in the skin cells to actually help to repair some of the telomeres from damage. And the 2 natural anti-aging components that you can use on your skin topically that are found in some products, number 1 is terpene, which is a vitamin K derivative. It actually stabilizes the telomeres and helps to prevent loss. And then the other one is caprylic acid, which is found in coconut oil. And I just talked about coconut oil. I love coconut oil. And it's absorbed about 100 times faster. And anything that you put in coconut oil is carried deeper into the skin faster. So you can incorporate things into the coconut oil that might not otherwise be absorbed that will be carried into the skin. And the caprylic acid is actually one of the very excellent things to help stabilize the telomerase on your skin. Mitochondria is another theory of aging, that the mitochondria basically are starting to lose their ability to produce oxygen because they are the powerhouse of the cell. They're responsible for cellular respiration and energy. And a lot of mutations do occur with aging and toxins predominantly. Aging and toxins kind of go along together because we're exposed to so many toxins in our everyday life. So it decreases the cellular energy and causes programmed cell death. And CoQ10 helps prevent mitochondrial damage and enhances the cellular respiration, helps the cell to form a little bit better. And this is the picture of the mitochondria. Well, this is actually the entire cell. The mitochondria, as you can see, are these little bitty kind of sawtooth-like looking things. The arrow is pointing to it, that are responsible really for a lot of the cellular respiration. And then there's the free radical theory, or the rusting or oxidation theory of skin aging. Actually, it works for all the organs too. And this is the theory that I have found to be one of the most useful in my practice because, and I think you know what the definition is, so I'm going to skip the definition about the free radicals. They attack the cell membranes. They create these waste products called lipofuscin, which is the little dark cells the little liver spots or the sunspots that you see. And that interferes with the ability of the cells to repair themselves. And actually, I want to say one thing right here, too. Tanning is a form of damage, oxidative damage. And a lot of people think that a tan is healthy and looks good. But in fact, every time your cells start to turn brown, that means that they're basically being oxidized. And oxidation is never really a good thing in our bodies. So basically, this lipofuscin interferes with the ability of the cells to repair themselves, and it causes collagen and elastin destruction, which is why you get thinner skin and the skin gets all wrinkly and you can start to see all the veins and stuff through it. And antioxidants in particular, and I listed some of them here, all of these antioxidants are good to help prevent the oxidation. I actually like Mega H, or Mega Hydrate, actually is the name that they call it now. It's the most potent antioxidant, actually, I think that's ever been invented. And it's the one that I like to use because you can see differences in your skin in the dark spots, usually within about 3 months of taking it. It still takes a while. I want to spend the rest of my time on my sort of gut-brain-skin axis theory is what I call it. And it's really based on all of the different things that I've done for the last about 15 years, I guess. So this is an abstract that was written actually much more recently, but I've been actually working on my theory for about the last 15 years. But this particular abstract kind of showed what I have been trying to say, and that basically what happened was over about 70 years ago, this dermatologist, John H. Stokes and Donald Pillsbury, first proposed a gastrointestinal mechanism for the overlap between depression, anxiety, and such skin conditions such as acne. And I'll say acne, seborrheic dermatitis, rosacea, a lot of nummular eczema. I mean, I could go on and on the skin diseases. Stokes and Pillsbury hypothesized that emotional states might alter the normal intestinal microflora, which we now are calling the microbiome, increase intestinal permeability, and contribute to systemic inflammation, which is what we're calling leaky gut right now. And among the remedies advocated were to take a good probiotic. And many aspects of this theory have been validated recently, and this was a study, it was published in 2011. And basically, I started doing this, as I said, about 15 years ago. So the ability of the gut microbiota and the oral probiotics to influence systemic inflammation, oxidative stress, glycemic control, tissue content, and even mood itself may have important implications in acne research, they say, but I'm going to say in skin research. And now, as you all know, since you've been here, it really in just general health all the way around. So it's really important, I think, if you start to have skin rashes and you start to have skin problems, a lot of times that's actually the beginning to know that there's actually a lot of things going on in your gut that really are not very good. And the gut is really, it's just so important for your immune system, and it's so important, again, for everything, for just general health. So this theory suggests that you can have too much or too little acid. You get increased or decreased intestinal permeability, so you can either have constipation or diarrhea. You get this significant alteration in the microflora, and that's actually created a lot by antibiotics. And as a medical professional, I do know that we have over many years prescribed way too many antibiotics for way too many conditions, and people take them, and that definitely impacts the ability of your gut to reestablish itself after the antibiotics. And a lot of people think that if you take an antibiotic and then the next month you can take a probiotic and it'll fix it. In fact, not. I'm going to say at least 6 months of probiotics after one course of antibiotics, and you might actually need a year. Okay, alteration. So basically, what we would like to do is to shift the balance, and this is what we want to do. This is what this entire conference is about. So, you want to shift it, so you want to have more nutrients in your body and fewer toxins. So you get rid of the toxins and you increase the nutrients. And that is it.
I have a quick question, and it's partially selfishly oriented, because I know that a lot of, even today and at this conference, there's been some conflicting views, which is okay, because I like to say a rising tide raises all ships. So when it comes to skin health, for me, I'm a proponent of, and I've read some research that shows that sun exposure occupationally can reduce certain risks of skin cancer, meaning if people are out in the sun on a regular basis because their body builds up to it, versus people that go out into the weekend warriors. Obviously getting sunburn isn't good. So I often tell my patients and clients that if they're getting 20 to 30 minutes a day regularly in the sun and then covering up mechanically with like a shirt or a hat, or like you said, a healthy chemical type sunblock, I typically recommend that. I'd love to hear what your recommendations are for skin, for sun exposure, for vitamin D, or general skin health.
I think what you're saying is probably okay for people who haven't had hours and hours of laying on the beach in Southern California or in Florida or whatever in their childhood, from the time that they were about 6 years old until their 30s. Because what happens is that all of this oxidative stress on the skin builds up over time. And even if you are getting a tan, if you have ever seen a 70-year-old person who, even though they have maybe more olive-ish skin, by the time they're 70 and they have all this excessive sun exposure, their skin is a disaster. And so if you want to look younger and you want to stay looking younger, you really have to start protecting your skin immediately after you realize that that's the case. And so I think if you haven't had a lot of sun exposure, and you probably see I haven't had a lot of sun exposure in my lifetime, which was very good because I burned and peeled, and finally got tired of it after a very short time. I think a little bit of sun's good, and sun obviously makes us feel good. I mean, it raises our mood and everything, just being in the sun. But you can be in the sun with a hat and, and protective clothing and cover up, and still have a really good time, which is what I do. The Michael Holick, the one who wrote the original book on vitamin D, I mean, he says different, if you look at the different strata of across of where, who gets sun and how much sun and all that kind of stuff, there's different lengths of time that you can safely be in the sun in order to get your vitamin D. Well, number one, I think that people don't get their vitamin D from those time frames. And number two, I think that it just builds up on damage that's already there. And the number of skin cancers, I mean, the statistics are that by the time you're 62, about 50% of all Americans have had skin cancer, which is really high.
So how about, so if someone is doing all the things that we know are healthy, taking antioxidants, eating healthy, they're doing all those things, in the ideal setting, what do you think would be an okay or an okay amount of sun that you'd be suggesting? And
Unprotected.
And during what
Are you talking
hours?
about unprotected?
Correct. Yeah.
Unprotected. Well, I don't think it's ever really safe to go out with your face unprotected, because that's the hardest place to get rid of skin cancer.
Sure.
I'm just saying.
What about arms or chest or back?
I think if you don't have a tremendous amount already of sun damage, I think that probably 20 to 30 minutes in a day, in not the heat of the day, in maybe the morning time or the late afternoon, probably would be all right. But I think, it's very expensive to have skin cancer. It's not cancer like Jenny has, which is, really serious, and lung cancer or anything. But, it can be very disfiguring, because some of the skin cancers can be in areas and locations that are very deep, because they are in the fascial plains,
Right.
in this area and around here. So I think it's a little bit, and I think the main reason to get sunshine is vitamin D. So I think everybody should take vitamin D, which
Awesome.
you already agree with that.
Yeah.
But, I protect my skin. I wear sunscreen pretty much every day. I just wear the zinc kind. I don't use any of the chemicals.
Awesome.
So,
Are you okay taking a quick question?
Sure.
Okay.
The free radical theory, and you were talking about high-powered antioxidants.
Yes.
And I didn't get what were
okay,
the types.
so the antioxidant that I've been using for about the last 15 years, which nobody has talked about here, it's a kind of an unusual product. It's called Mega Hydrate. And it's basically negatively charged hydrogen ions in a silica microcluster with a few little minerals added in. It's about 20,000 times stronger than any other antioxidant. All it does is replace the hydrogen ions from all the other molecules, including CoQ10, alpha-lipoic acid, vitamin C, the carotenes, whatever it is that you think about. It just replaces those hydrogen ions when they go in and donate their hydrogen ion to get rid of the free radicals. So basically what it does is it recycles all of your antioxidants. And, because of that, it's so powerful. It's a teeny little capsule. I mean, it's not a big pill. It's not, so it's really easy to take. And the two pharmacies in the area that have bought it for me, that will sell it to patients, are Lone Pine Pharmacy and Allswell in Ashland.
And one other question.
What is your recommendation for best source of probiotics? Yogurt, kefir, fermented foods?
Well, I think all of them are good, and I think everybody should incorporate a lot of them in your diet. I truly think that depending on your history of how many antibiotics you've taken and how much stress you're under and how sick you are over time, I think a lot of people actually need to take an oral probiotic. I think that and certainly if you've taken antibiotics, you have to take an oral probiotic at least 6 months, because you just don't replenish the good bacteria just doesn't recover as quickly as it needs to after the antibiotic therapy. If you're not taking antibiotics, and if you're really healthy and you're feeling really good, then incorporating all of those. I do them all. I love kefir. I love yogurt. I'll do all kinds of fermented foods I just love. And, they should be incorporated into your daily diet, because that's really the natural way to get it. But, you have to take a pill. And the problem with the pills, of course, is a lot of them, the probiotics are dead when you buy them. And, so Consumer Labs is a company that does testing regularly on all the supplements. But, in probiotics in particular, there was a very large number that, didn't pass because the bacteria were already dead. So you have to try and make sure that you buy a really good one. It doesn't necessarily have to be expensive, huh? Well, the refrigerated ones, not necessarily. Some of them don't pass either. And I can't tell you from month to month, well, actually it was six or 7 months ago, I guess, was the last time they tested. Align actually did okay. All right, so Align actually passed, which is one that you can buy at Walmart, whereas one of the really expensive refrigerated ones didn't pass. So I can't tell you for certain, which ones. You have to sort of go from time to time. But the one that I like is made by Integrative Therapeutics. It's actually really inexpensive. It's called Yeast Balance Complex, and it's a probiotic, but it's also got garlic and pudarca and berberine milk thistle, golden seal, and digestive enzymes in it. So it's kind of a really complete gut kind of product, and I use it a lot for all of my patients who have adult acne and rosacea and nummular eczema and, you just name it, because it works really well.
Awesome.
Integrative Therapeutics, you can buy it online.
Thank you.